Okay, so this is gonna be my video. I'm also gonna have somebody helping me, but this is gonna be my video. Okay, so first I'm gonna start off by doing some hand hygiene. I'm gonna do that with my hand sanitizer, and I'm going to rub it in until it is completely dry. So once it's completely dry, then I'm gonna put my gown on first. So now I'm gonna put my gloves on. And I'm gonna put my gloves over my cuff. And then I'm gonna walk into my patient's room. Okay, me and my assistant is gonna go in there. All right, knock knock. Hi, Miss Ayana, how are you feeling today?
I'm good.
Okay, my name is Kaylin, and I'm gonna be your student nurse. I'm from UNCP.
Alright, my name is Sarah, and I'm also from USP, and I'm gonna be your assistant.
She's my assistant, so she's gonna help me out with some things for you today, okay?
Okay.
All right, can you just verify your name and date of birth?
Diana Strickland, 8/12/05.
Okay, great. And now I'm gonna provide her with privacy. I would put the curtain all the way around. So now, today we are going to be doing a bed bath on you, okay?
Okay.
All right, so it's gonna take about 10-15 minutes, okay? So I'm just gonna raise your bed really quickly. Okay, so this is our working position, okay? Alright, so we're just gonna get started on her face. I have my soapy water and then I have my normal water. I'm gonna use my normal water to clean her face. We're not using soap. Can you just feel that real quick? Okay.
It's good.
Okay. So, get my towel. You got a towel?
Mm-hmm.
Okay.
I need a rag.
So I'm gonna slip this towel behind her head. I'm just gonna take her pillow and I'm gonna move it over here to the side. Let me get that back to you. Sorry. And now I'm gonna wipe from her inner to her outer, inner to her outer. I'm gonna use a different side, inner, outer, and then I'm gonna wash the rest of her face. And then I'm gonna take this and I'm going to dry it off. Okay. So now I'm gonna go down to her arms. Okay, I'm gonna give you your pillow back, okay? Alright. So now what we're gonna do is we're gonna go on and take her gown off so we have access to her arms. So we are making sure that we are gonna take the unaffected side out last. Yeah, we're taking the unaffected side out last. So if she has something wrong with the arm, we're gonna take that one out last. So we made sure that we took her unaffected arm out first. And then her affected arm goes out last. Okay, so we're gonna expose her arm. And then we're just gonna get our water. And so our soap and water. So when we do her fingers, we're gonna make sure we get down out here her fingers. We're gonna get in all those crevices, and then we are gonna use a different side, and we're gonna continue to work our way up the arm, different sides. And then we're also gonna make sure that we're getting under her arm. we're gonna pat her dry with the towel underneath her. Okay. Do you want some deodorant?
Yes.
So I asked her, does she want some deodorant? She does. Okay. Now put it on this side. And that side. Okay. So I'm gonna move this. And I'm gonna ask her if she wants any lotion. Would you like any lotion? No, she doesn't want any lotion, so we're not gonna put any lotion on. So now we're gonna expose her abdomen and only the abdomen. So I'm gonna get some soapy water. And now we're going to wash all around. If she is a woman, we're gonna make sure that we're getting under this breast. Getting under the neck. Any lotion? She doesn't want any lotion. Okay. And then we're also gonna dry. Okay, so we're gonna pick it back up. And now we're gonna go down to her legs. And I'm going to place a towel under her leg. Okay, now we're gonna get our towel again. And now we are going to wipe on here, using a new side. Okay, now that we got that done, now we're gonna go down to her feet. Oh, and we're gonna pat her dry too before we go to her feet. You doing good? So now we're gonna do her feet. Did you want any lotion on your legs?
Oh.
Yeah. Okay. Okay, so now I'm gonna place this under her feet. Okay. Now we're gonna make sure that we're getting in between her toes, and we're just washing all around, bottom, sides, using a new piece every time. Okay. So now we're gonna make sure we dry off her toes, making sure we definitely dry in between those toes to reduce the risk of breakdown. Alright. Doing good? Okay. Put it back. Alright, so what I'm gonna do now is I'm gonna ask Miss Sarah to put up her side rail. And I just want you to hold on to that side rail and go that way. Good. So I'm gonna place this towel down behind her.
And then I will discard these.
Yeah, she's gonna discard her. So now, so after we do her toes, before we go on the back, we're gonna make sure that we change our water out. So I would go and get some more water after her feet. We're gonna get different water, and then we're gonna do her back. So we have different water. If I noticed that my hands were soiled, I could do a glove change, hand hygiene. So she's gonna feel this real quick. Can you feel this?
It's good.
Yeah, she said it's good. So now I'm gonna get started on her back. So now I'm going to get some water, and I'm just gonna do her back, making sure we get all the sides. Okay, and now I'm gonna dry her off. So now I'm gonna expose her bottom, and I'm also going to, when I'm wiping this, I'm making sure that I am going from front to back, so like this, using a new side each swipe. Okay, so now I'm going to dry her off. Okay. And now I'm gonna ask her just to lay back. So now I'm gonna go change my water to do her hair. So I'm gonna change my water. If I notice that they're soiled, I'm going to do a glove change and I'm gonna do some hand hygiene. So I have new water to do her front and she's gonna feel it. She said it's good. Okay. I dropped my towel. I'm gonna get a new towel because I wouldn't pick up a towel and then reuse it. So I'm gonna get a new towel because I have extra right here. Okay, so I got a new towel. Alright, so since she's able, I'm gonna ask her to pick up her knees, bend them, and spread them out just a little bit. Only exposing what I need. Okay, so I'm gonna place this under her. Alright. And now I'm gonna do the outsides. Each time I do the outside, I am using a new spot. And now when I go to her labia, I'm gonna open it up. I'm gonna do the outer edge. I'm gonna use a new side, outer edge, new side, and then I'm going to do the middle. Okay, and then she's clean. And now we're gonna dry her off. So we're gonna dry it, and then we are going to put her back in bed. Cover her up. Okay, so if my hands are soiled, well, I definitely should do a glove change and hand hygiene before I go to the next thing. So I'm gonna put on a new gown. So I'm gonna first start by putting the affected arm in first. So whatever arm is affected, we're gonna put it in first. Now we're gonna put the other side in. Now we're gonna maintain her privacy. Okay. Alright, how do you feel now? Good, okay. So, what we're gonna do now is I'm gonna take your dentures out and I'm gonna clean them, okay? Alright, so I'm gonna lift your bed up so I can take your dentures out. Alright, so now I'm gonna take her dentures out, okay? Okay, got her dentures. They're right here. I'm gonna go and clean them. Grab this. For video purposes, I would have a rag, a separate rag, but I'm not going to put a clean rag in here. I'm going to put a rag down here, and then I am going to put some toothpaste on my toothbrush. Toothpaste on the toothbrush, and then I'm going to wet it. And then I am going to take a picture. And I'm going to clean it, making sure I'm getting it all good. Where it's long. And I'm gonna ask my client if she would like me to put them back in her. Hey, Miss Ayana, would you like your dentures put in? Okay, so since she doesn't want her dentures put in, I would fill it up with water and I would leave it on her bedside until she wants her dentures so she can put them in. And so I would change my gloves and do some hand hygiene. Okay, so now I'm going to put her She doesn't want her ditcher, so they're gonna stay on her bedside table where she can reach them. I'm going to put her top down. Alright, Miss Ayana, what I'm about to do is I'm about to change your bed linens, okay? So this should take me about 10 minutes to do, alright? I'm gonna lift you back up so I don't hurt my back. Okay. Alright, so I'm gonna take this side off. Okay, so we're just gonna get it done real quick, alright? 10 minutes, that's all we need. Alright, Miss Sarah, I'm gonna ask you to pick that side rail up. And Miss Ayana, what I want you to do is I want you to turn on that side, pull that side rail if you need to. Let's pull this down. She has her gown on. Okay. We're gonna pull everything to the side. Pulling it away from us, making sure it's not touching us. There we go. Alright. Now I'm gonna put the new one on the side. Alright, I'm gonna take your pillow, okay? Sorry. Alright. Can you put that one in? Put this one up. And now we're also gonna put your pad down. Alright. Can you turn this way for me? Alright, and then I'm just gonna ask Miss Sarah to pull the rest of that off. She's gonna pull it away from herself, making sure it's not touching her. And so while she's doing that, I'm going to change up this pillowcase. I'm gonna take the new pillowcase and I'm going to fold it inside out. I'm gonna put it on. Alright, you can let roll back. And I'm gonna ask Miss Sarah to pull that pad all the way through. then we're gonna put her back on. Put her cover back on. You doing good?
Mhm.
Okay, good. All right, so Miss Ayana, now what I'm gonna do is I'm gonna put your SCDs back on. I'm gonna put your TED hose on, and then I'm gonna put an SCD on. Okay. All right, so I would expose her leg. Okay, so for her TED hose, what I'm gonna do is I'm gonna slide it my hand in. I'm gonna work it all the way up until I get to the heel. I'm gonna get to the heel of the TED hose, and then I'm gonna pull it inside out, and then I would put it on over her heel, slide it all the way up, making sure that there's no wrinkles or twist in it. And then I'd also make sure that the hole is over the toes. Okay. So her TED hose is on. And I'm also going to be putting on an SCD. So before I put on her SCD, I have to make sure I measure her cow. I would also do this for the TED hose. I would also make sure before I put my TED hose on, I would measure the circumference of the widest part of her calf. All right. So I'm gonna measure it. Okay. Make sure I get the right size TED hose and the right size SCD. And then I would put her SCD on, making sure that there is 2 finger lengths worth of room in here. Okay, and I would leave them on as long as the provider has ordered, and I would also make sure that she has 8 hours without them. Okay, so I would take off the SCD like this, and then I would pull her TED hose down and off. Okay. So I'm just gonna put this back on over her. All right, so Miss Ayana, I am done with everything. Thank you for letting me do that for you. I hope you feel better.
Yes, thank you.
I'm also gonna give you your call out. Make sure your call out light is within reach, and I just want you to, if it's an emergency, you know, press it, right? So, and I'll be back in an hour to do other things. And I'm gonna put your bed back in the lowest position. Okay. So I'm gonna take off my PPE now. So I would rip off my gown, and I'm also going to make sure that my gloves are going with my gown, making sure I'm not touching the top of it, and then I'm gonna throw them away.